Hello, my name is Corrine McIsaac, and I am a professor of nursing at Cape Breton University in Canada. And today I would like to talk to you about the importance of post-discharge surveillance in understanding surgical wound complications. I do have one disclosure. I am the founder of Health Outcomes Worldwide, and we have developed and tested an application for post-discharge surveillance. The objectives for this session are to discuss the challenges, the importance, and the lack of standardized post-operative surveillance, or PDS, to demonstrate improved patient and system outcomes when post-discharge surveillance is done in a standardized methodology, and demonstrate how the standardization of nomenclature, data collection tools, and technology can assist with earlier detection of surgical wound complications. So the genesis of my research and how I became really interested in this topic is I was a manager of a home care service where I was responsible for a large number of nurses in a rural area. And when we were trying to learn really about wound care, we started collecting data. And one of the things that we found way back in 2007, and is actually common today, right up until 2021 today, is that if we looked at a graph, and this graph that you can see here, there was a lot of what we were calling at the time open surgical wounds or surgical wound complications. So I really wanted to have a look at that to see if there was something we could do for these patients, and obviously to improve outcomes. So just a little bit of background. Everyone knows lots of surgeries going on worldwide. Surgical site infections are really costly, and they're one of the most common hospital-acquired infections still today, even with all the wonderful work that's going on in the world. The estimated annual incidence of SSIs range from about 2 to 5%. And if you're having any sort of abdominal surgery, it can be as high as 33%. But we really believe that the true incidence of surgical site infection is really probably underestimated in the literature because many occur after discharge without a standardized post-discharge surveillance. Furthermore, surgical site infections or surgical wound complications increase hospital stays. There's a 2 to 11-fold increase in mortality. Patients that have had a surgical site infection have reduced quality of life, greater physical limitations, require more services. And although most surgical site infections of superficial and deep infections and complications recover, the infection is the cause of death in 77% of the people who die after readmission. And we know surgical site infections, being one of the surgical wound complications, are costly, and they cost the healthcare system a lot of money. We also have some detection and monitoring of surgical wound complications. We also have some issues. From the literature, the most accurate method for detection and monitoring of surgical wound infection or surgical wound complication is the direct method. We know that this isn't feasible all the time due to budget restraints, early discharge, and a lot of patients, having surgery done on an outpatient basis. And most patients are usually monitored of one of a couple of ways, either by reviewing microbiology, by looking at reports, retrospective chart reviews, and maybe looking at prescriptions as well. We could not find a standardized methodology for post-discharge surveillance in the literature, and so that's definitely problematic. We do know that if you do some kind, though, of PDS, surgical site infection rates increase. McIsaac and Bolton reported that in one Canadian study that when it was done with technology, there was an increase of surgical site infections found as high as 34.6% of a population that attended a clinic. There's also commentary in the literature that there are poor return rates for physician calls and questionnaires. And if there is a mandatory process, some scientists have found that it actually picks up 62% more surgical site infections. So lots of good evidence telling us that we should be doing some sort of standard methodology in the literature. This is another Canadian study just to sort of demonstrate again that we might be missing a lot in the way we do follow-up currently. This group looked at over 622,000 patient charts. They retrospectively looked at their patient charts. 84,000 patients had a surgical wound complication. Over 48,000 of those were diagnosed on post-op day 10, so at home. Over 11,000 had a return to the ER, and over 5,000 were readmitted to hospital. The cost for the ER visits was approximately $1.7 million, and for the over 5,000 readmissions, between 52 to 132 million. So by missing a lot of this, it's pretty concrete and pretty obvious that there's also cost, to the system. So how do we improve this? How do we improve PDS? Personally, and sort of not only myself, but looking at other scientists and what people are doing around the world, we really need to standardize our nomenclature. We have to be talking the same terms all the time. I think it's also really important that we standardize and almost pick a data collection tool with at least a minimum data set of standardized variables that we all collect. The use of technology, I believe, is critical, and the future use of that data for analytics. So in other words, if we had a standardized tool where we were all putting in a minimum data set around surgical site infection with photography, that could be used, with the current data analytic techniques and really help us improve patient care. So nomenclature and standardization, I'm just showing you two things here. This is the international consensus document that, of course, Kylie and team are launching here today. And that would be a very good place for people to start. Standardization. In this article by myself and Dr. Bolton, we actually looked at using the CDC guidelines for our standardized data collection tool around a surgical site infection, and we had a very high confidence intervals and inter-rate over 85% confidence intervals in our test of inter-rater reliability. So I think, just to get back to the points I made, it's just important that we have some standardized processes that work. There are lots of really exciting things going on around post-discharge surveillance. The AANA also recommend in their post-discharge recommendations that technology is used to improve the follow-up. And of course, ERAS, early recovery after surgery, there's a number of really exciting interventions going on as well. The World Health Organization also points out to us that surgical site surveillance needs to be an integral part of any of our infection programs. And obviously, there's a lot going on in the world. I think we can just improve on it. This is not to say that there's not enough going on. We just can improve on it. In the study that I mentioned to you earlier, we actually we use the CDC guidelines as our data collection tool, and we found that by following patients 30 days post-operatively in community, that we picked up about 34.6% of more infections post-operatively, so out in the community. And that really concurs with a lot of other researchers that are doing work in this area, and they've found much higher rates when post-discharge surveillance is done in a very standardized fashion. An example of technology, there's several of them on the market right now. They're used to track, monitor, and detect surgical wound complications, and of course other things in the post-op journey. Patients are usually engaged in some way to document their experience, and this allows surgeons, their teams, infection control teams, to identify complications, surgical wound complications earlier. And of course, virtual visits now in our new age, post-COVID, we're much more comfortable with that, and many of the applications offer that. So in this particular application, basically the patient takes a picture of their incision. They also answer a series of questions, and the way it's displayed to the healthcare team, the picture is there so you can have a good look at that. You can zoom in on the picture, and it also points out to the team things that may be out of whack, whether there's a temperature or where there's the incisional drainage is different, etc. Patients report that it's really easy to do. They just take the picture and it automatically gets synced into the app. They don't have to go through any uploading or anything like that. And it allows for a very easy way to communicate with patients post-operatively. So the benefits of post-discharge surveillance with technology are earlier detection, decreased ER visits, enables surgeons and patients to communicate easily, decreases readmissions, and also physicians also reported to us that it opened up their office. In other words, they didn't have a lot of people with a post-wound complication. They were able to take in more new patients because patients with these surgical wound complications that were picked up with technology were handled at home. So in summary, I believe a standardized PDS process is critical to detect and treat surgical wound complications earlier. And those essential components, just to review, are standardized nomenclature, standardized data collection tools, the use of technology, my hope, the development of a database, and then the use of this data with photography to build predictive analytics. Thank you, and have a great day.